Are infrared saunas safe? Infrared saunas have gained popularity for their potential health benefits, including relaxation, pain relief, and detoxification. Unlike traditional saunas, they use infrared light to heat the body directly rather than heating the air around you. But are they safe? This guide explores the potential risks, benefits, and precautions of using an infrared sauna. 1. How infrared saunas work. Infrared saunas use infrared light waves to penetrate the skin and raise body temperature without excessively heating the surrounding air. They operate at lower temperatures, 120 degrees Fahrenheit to 150 degrees Fahrenheit, than traditional steam or dry saunas, making them more comfortable for many users. Second, potential health benefits. Many users and some studies suggest infrared saunas may provide muscle relaxation and pain relief, helps with arthritis, joint pain, and muscle recovery. Improved circulation increases blood flow similar to moderate exercise. Detoxification. Some believe sweating helps remove toxins, though evidence is mixed. Stress reduction and better sleep promotes relaxation by lowering cortisol levels. Skin health improvements may boost collagen production and promote clearer skin. 3. Are infrared saunas safe? For most healthy individuals, infrared saunas are generally safe when used correctly. They provide the same benefits as traditional saunas with lower heat stress on the body. However, there are some safety concerns to consider. Fourth, potential risks and side effects. While infrared saunas are safe for most people, they may cause dehydration. Excessive sweating can lead to fluid loss if you don't drink enough water. Overheating. Prolonged use may cause dizziness, nausea, or heat exhaustion. Blood pressure changes can cause a drop in blood pressure, potentially leading to lightheadedness. Skin sensitivity. Some individuals may experience irritation or burns if they have sensitive skin. 5. Who should avoid infrared saunas? Infrared saunas may not be safe for certain individuals, including pregnant women. Heat exposure may pose risks to fetal development. People with heart conditions. Those with low blood pressure or heart disease should consult a doctor first. Individuals with heat sensitivity, some medical conditions or medications can impair the body's ability to regulate heat. Those with implants or medical devices, infrared heat may affect some metal implants, pacemakers, or artificial joints. 6. How to use an infrared sauna safely. To maximize benefits while staying safe, follow these guidelines. Stay hydrated. Drink plenty of water before and after use. Limit session time. Start with 10 to 15 minutes, gradually increasing to 20 to 30 minutes. Avoid alcohol. Alcohol increases dehydration and the risk of overheating. Listen to your body. If you feel dizzy, nauseous, or uncomfortable, exit immediately. Use a moderate temperature. Keep the sauna between 110 degrees Fahrenheit and 140 degrees Fahrenheit to avoid excessive heat exposure. 7. Are infrared saunas safer than traditional saunas? Infrared saunas are considered safer for most people because they operate at lower temperatures than traditional steam or dry saunas. This reduces heat stress on the body, making them more tolerable, especially for those sensitive to high heat. Infrared saunas are generally safe for most healthy individuals when used properly. They offer numerous potential benefits, but users should stay hydrated, monitor their body's response, and follow safety precautions. If you have underlying health conditions, it's best to consult a doctor before using an infrared sauna.